This is St. Vincent's Health Talk, a video magazine with the latest news and developments from St. Vincent's Health Services. In this edition, we'll focus on accolades for our stroke program, advances being made in the treatment of atrial fibrillation, and updates on our master facilities plan and in the Department of Surgery. At St. Vincent's, we're investing in the future and working hard to be the hospital of choice for patients, employees, and physicians. In early 2007, the Medical Center embarked on a new program which offers patients and former patients an opportunity to provide input on patient care. Our Patient Family Advisory Board, under the direction of Vice President of Patient Outcomes Carrie Eaton, has made significant contributions. Here, Donald Saltzman and Jack Hardy talk about their experiences with St. Vincent's.
I understand why I had such good care. It's the people. Everybody. Every nurse, every technician, the staff, the clerical people, especially the doctors, they are good technicians, but they're also great people that care. They heal with love, they take care of you, and that attitude helped me recover very quickly, where they agreed to send me home on the 6th day.
They did an outstanding job. We went from the emergency room up to the, they call it the CC ICU. I think that's the name. And that staff was absolutely outstanding. Not only did they take extremely good care of my wife, they took excellent care of myself and my daughters. I have 3 daughters, and they could not have made it any easier for us. We knew at that point that my wife was probably going to die. That our purpose is both for the visitor and primarily the patient. We're not part of the organization, don't get paid by the organization. Everybody works voluntarily, but we're here to make sure that we do the best we possibly can for the patient and the families. And so I think that message is important to get across.
In future editions of Health Talk, we'll hear from other members of the advisory board. Now let's turn to our news summary. Our stroke program, under the direction of Dr. Suranath Kadimi, continues to be recognized by outside organizations for outstanding care of our stroke patients. In November, a site visit from the state examined the diagnostic evaluation and treatment of stroke patients. The visit resulted in our stroke program earning recognition as a JACO Primary Stroke Center and a Connecticut State Primary Stroke Center, 2 of the highest recognitions possible. Here, Jennifer Nascimento, stroke coordinator, discusses the significance of these 2 recognitions, as well as the American Heart Association's Get With the Guidelines Stroke Goal Performance Award.
I would say we're most proud of our community education that we do. We do 20 programs a year for the community. We're only required to do 2, but we have gone above and beyond because we feel that that's really important. We're trying to promote awareness in this community and also in the state, and what we've accomplished is we've increased our rate of TPA from 2% to 12%, and nationally only 2% get TPA, 2% of the population, so we're very proud, especially being a smaller hospital. I think it also recognizes the program, the staff. We can share with them that they were part of this, that helped us get this award. It also demonstrates to the public that, and patients, that we are committed to a high standard of care.
In August 2008, St. Vincent's, in partnership with National Healing, opened the first of its kind Center for Wound Healing in Trumbull, Connecticut. Located on Route 111 on the Trumbull-Monroe border, the center is staffed with experts in the treatment of wounds and offers 2 hyperbaric oxygen chambers, which improve and quicken the healing process. Medical Director Dr. Jitendra Barucha will lead a staff of physicians, nurses, therapists, and other healthcare professionals who will exclusively care for patients with non-healing chronic wounds. Dr. Barucha shares his mission for the center and the impact on patient care.
Well, up until now, patients who had chronic wounds really did not have any particular place for them to be diagnosed, treated, and more important than that, consistently followed till they were completely healed. So our wound care center is certainly going to provide that place where they come not only for their initial diagnosis and treatment, but be followed all the way until they are completely healed. To now, we have scientifically proven treatments, and especially topical treatments of different type of gels, sponges, foams, and now we also have vacuum dressings. We have biologically engineered matrix dressing that provides collagen to the wounds. We also have bioengineered cell cultures such as keratinocytes, appligrafts, oasis, and then we also have hyperbaric oxygen chamber to provide an oxygenation to the areas of the body which are not healing because of decreased oxygenation of that tissue.
And now for our feature stories. More than 5 million Americans suffer from an irregular or rapid heartbeat, known as atrial fibrillation, or A-Fib. Medications are often the first line of defense to treat A-Fib, but now new alternatives exist for those who find little or no relief from the drugs. The Division of Cardiothoracic Surgery, led by Dr. Rafael Squitieri and Dr. Albert DeMeo, has perfected a new, minimally invasive technique for treating A-Fib. With success rates far exceeding the national standards, Dr. Squitieri discusses the positive impact the procedure can have on patients.
Recently, we've added surgical therapy to the treatment of atrial fibrillation. There's been many iterations of surgical therapy over the years, but most recently, a very exciting procedure has been developed around new technology to do those ablation procedures on the heart with a beating heart without using the heart-lung machine or doing a major incision that are very, very effective at reestablishing sinus rhythm for those patients. So much more effective than catheter-based approaches, which may be 50% successful. Surgery for well-selected patients can be 80, 90+% successful in restoring sinus rhythm, alleviating those symptoms, getting the patients off their medications, and at the same time we remove that portion of the heart, the left atrial appendage, where clots can form. And I think that's a major advantage of the surgical therapy. And the fact now that we can do the operation, the standard operation, through now very, very small keyhole incisions in both chests under anesthesia has really changed the way we're looking at using surgery to treat atrial fibrillation. The patients stay 1 or 2 days in the hospital. The recoveries have been remarkably shorter and much more well tolerated by the patients. So
it's very exciting. You know, we're constantly learning about it. There are teams, really several throughout the country, a few in Europe, that are all sharing information and techniques. It's still going to really develop over the next 6 months to a year, but we're happy to be off to a very good start and with good results here at St. V's, and it's something we're looking towards as a really great operation we can offer our patients with A-Fib. So it's been exciting so far.
St. Vincent's is the only hospital in Connecticut offering this minimally invasive option. In October, the Medical Center welcomed Dr. Douglas Ross as Chairman of Surgery and Clinical Vice President of Surgery. Dr. Ross, an otolaryngologist, comes to St. Vincent's from Yale New Haven Medical Center. Having served in numerous positions over 15 years, Dr. Ross was Vice Chief and Program Director in Otolaryngology and a professor in the Otolaryngology section in the Department of Surgery at Yale University School of Medicine. In his first few months, says Chairman, Dr. Ross has met many of his colleagues and is excited about the opportunities St. Vincent's offers for growing the surgical service line.
Well, my vision for the surgical service line is really to create the best surgical experience for our patients and the best, the highest quality surgery performed in Connecticut. That's my goal. One of the things I like to do, and I have an expertise in, is endoscopic sinus surgery. That's working on people's sinuses through the nose, no cuts on the outside of the face usually. We're able to open up the sinuses from inside the nose, allow them to drain better, get rid of or at least improve polyp formation, allergy, problems with allergy and sinuses, asthma and sinuses are all improved using endoscopic techniques inside the nose. I also have an interest in base of skull surgery through the nose, getting to the skull base and getting into the brain to do brain resection or other brain resections or tumor resections inside the nose.
A specialist in endoscopic sinus surgery, Dr. Ross brings a unique service to the patients of Fairfield County. The first completed component of the $141 million master facility project, the new main campus garage, has been a welcome addition for physicians, staff, visitors, and patients. Progress continues to be made on the other areas of the expansion, a new 125,000 square foot, 4-story wing housing the Elizabeth M. Freem Swim Center for Cancer Care and the Michael J. Daly Emergency Department. As we anticipate the opening of the Swim Center for Cancer Care in November, Dr. Stuart Marcus, Interim Chief Medical Officer and Chairman of Oncology, discusses the future of cancer care at St. Vincent's Medical Center.
Well, the new cancer center will mean a great deal for this community. It will allow us to bring comprehensive cancer services all under one roof. Currently, many patients have to travel from practitioner to practitioner in order to receive the comprehensive care that they deserve. But once they come here to our cancer center, they'll be able to see all the providers under one roof, obtain comprehensive diagnostic services, obtain treatment in a compassionate, healing environment, and will really receive state-of-the-art, optimal cancer care here locally in Bridgeport.
Coinciding with the progress on the construction side has been the overwhelming response of staff to the capital campaign, which will fund the building project. To date, almost $3 million has been raised by St. Vincent's employees, and $38 million has been committed to the campaign overall as of December 2008. The campaign, which went public in September 2008, has a goal of raising $42 million. Thanks for watching Health Talk. We leave you with some additional images of our new garage and the progress being made on the Swim Center for Cancer Care.